What's going on, TDL fam? Today we finna update y'all with the pregnancy journey that we actually been going through. We said we're gonna update y'all as quick as possible, and this is quick as possible to us. So yeah, so we finna get into it.
Okay, so basically, you guys, the last video we went over all the complications that I was going through with the pregnancy. But today we have updates, good news, bad news,
Shocking news.
Yes, yes. So basically, we are here to tell you guys I'm not pregnant anymore.
Yeah, she's not pregnant. She's not pregnant.
I had the baby, and we just going to go into detail from day one, from me, leading into me having the baby.
From the day that
the problem started.
When it started, when we did the gender reveal.
Yeah, after we did the gender reveal.
Yeah.
Then, yeah.
Yeah, that's when it started. After we did the gender reveal. That's why we ain't been posting, cause after that, a lot of
complications.
Been
chaos. Hurting. You guys, I told you guys that I was doing better with the morning sickness. Basically, I was hurting more, stomach cramping. I was just going through it. So basically, I got rushed to the hospital, Birmingham. I got rushed to Birmingham.
What's going on, Dudley fam? We in a rush right now, cause she's bleeding, and we trying to get out the house right now. I'm waiting on her mom right now, cause this I don't want to jinx nothing, so I'm gonna keep my mouth closed, but hope for the best. Huh. There you go.
I can't find it. No, I just made a mistake and deleted it.
You made a mistake and deleted it.
It was on my notepad.
It's on in that thing. What? That paper.
Yeah, it's on that paper.
Oh. Come on, where that paper? That paper with that number on it. I think it's right here. Is this it? Yeah, it's it. Huh. Here you go. Go ahead and call. Yeah, she okay. I'm just trying to wait on your mama now. I took it that time.
Yes, he took me.
I took it that time.
Because I had started spotting, started bleeding, blood clots. It wasn't heavy, but it still, I was told to go to the emergency room if I see any type of bleeding of blood.
Alright, y'all. Right now, I'm currently at the gas station. Bro, I wasn't prepared for this. So, after this, I'm hitting the road. I'm kind of nervous too, but hey, everything gonna be alright. I'll see y'all when I get there.
So when I got there, of course they checked me out. The bleeding stopped. They was like, "You was bleeding?" I'm like,
"You okay?"
"Yes, you okay."
You okay? Thumbs up.
We just gonna monitor the baby for a little bit more, and they actually sent me home.
Yeah, they did that.
Is that right?
Yeah.
And our team looked with the speculum, there wasn't any evidence of active bleeding. Now with the previa, with the placenta previa, you may have episodes like this.
Okay.
And if it's anything more than a single spot, especially if it's anything that's kind of like menstrual blood, you just, unfortunately, you've got to come be evaluated. And even if it means you get sent home because we're reassured, that's better safe than sorry.
Yeah, that's why I came.
Yeah.
Like, okay.
I know, but I'm just sort of apologizing beforehand because it can be frustrating. You're like, oh, it went, and they sent me home again. But we don't want you to have the burden of making the decision about, is this bleeding that's threatening to me or my baby, or is this bleeding that's okay?
Yes, sir.
And you don't need to worry yourself with making that decision. If you have anything that's more than a spot or two, and it's concerning, and you notice it is bright red, come to the hospital. Okay? Because it could be the beginning of like a hemorrhage, and you need to be delivered. But for right now, 25 weeks with stable mama and stable baby with no active bleeding, we want to keep that baby cooking. Okay?
Yes, sir.
Alright, well, we're going to let you get out of here in just a little bit, okay?
Okay.
Okay, thank you.
They sent me home, so got
We
home.
thought we were Gucci. Straight. And now.
So I got home. I still was on bed rest. I still doing light duties. Then by 3 days after we went to Birmingham.
Yeah, about 3 or 4 days.
Yeah.
Yeah, about 3 or 4 days.
So I took a bath, laid on the sofa, sleeping the whole day. I was cramping, almost crying, hurting in pain. Yeah, I was crying. I was. When I tell you guys, I was hurt.
And she was calling my name.
He said, "What I'm supposed to do?"
I couldn't do that. Like, what am I supposed to do?
You guys don't know how
so-
much pain there was. It was devastating. But anyway, laying on the sofa, then I was asleep. Then I had my 2-year-old on the sofa with me also. She was playing on my phone, and I was asleep. Then I woke up, and it felt like my water broke. But I was like, oh, I didn't want to move.
That was scary.
I was calling him because I was hurt. Then it felt like my water broke.
That scared me. I was like, what? Hey,
And I was
what?
like-
We ain't prepared.
Yes. Then I was like, check, because I think I'm bleeding. So,
I said, we ain't even got the backpack yet.
yeah.
I was like, hold up.
So with this one, it was worse than the first one. So he wasn't able to take me to Birmingham this time. We went to the local hospital. Basically, my doctor here, I still had a doctor here also. So I went to the local hospital that the pregnancy doctor in my hometown be at. So when I went there, of course, they admitted me quick. Blood clots, a whole lot of blood, and I was still bleeding heavy when I got there. They admitted me on, it was like a Sunday.
Yeah, it was Sunday.
Like March the 7th.
Yes.
It was on a Sunday.
Yes.
And I was there, devastated. Then, of course, I didn't want to leave my other kids. It was devastated. It was hard for them to even find a vein. They say it was always hard to find your vein. So they were sticking me everywhere. I had bruises all over my arm. The first IV she gave me, it was right here.
Mm-hmm.
That was fine. The first one she gave me was fine. And this hand right here. But pulling blood, oh my God. That did it. So basically, of course, they didn't want to pull blood from the same arm or hand that the IV was in. So they went to the opposite, of course. And they started with my arm. Then they bruised my arm up. Then they went to my hand. Then they went everywhere.
Yeah.
Pulling blood.
And
I had to get blood
Me?
poured often.
me, I'm just looking at it like, dog, like, she's going through a lot. Like,
Yes.
a lot.
Yes.
Like, me just sitting down on the sofa, I'm just looking at it like, yo, this is truly a lot. Like,
You say training on me?
like a lot. Like, she's getting stuck everywhere. She's, you know what I'm saying?
Band-aids
I
everywhere.
don't want to say, you know, but she's like woozy and all that, ready to go to sleep
Yeah.
all the time. Like, I was like,
The medication they had me on, of course, when I first got there, they gave me pain medication because I was in pain. I was actually having contractions. I didn't know. I didn't know. I was just cramping real bad. But they told me it was normal with the previous placenta that
yeah.
I was going to bleed. So that was Birmingham talking about.
And then, what happened after that?
Oh.
The doctor, we had a doctor came in there. That was a nurse. Or a
Yeah,
doctor?
yes, but it was a doctor, and of course,
telling us about the baby,
yes,
about the early stages of what the baby
Preterm.
going through.
Mhm.
Well,
what to
when she-
expect
yeah, when she have the baby.
if I have it preterm.
Yeah.
I have the baby preterm. What to expect? The lungs not fully developed, the brain not fully developed. If I have the baby this early.
Start from the beginning about what to expect at delivery, and just in case he does come soon, that way you can kind of know what to expect. But we're hoping that he can stay in for a while, because every day and every week he stays in, the better he'll do. Okay, so at this age, everything is just gonna not be fully developed. 25 weekers, their survival rates are pretty good. But they definitely have risk of lots of different complications. So at delivery, it's going to be a C-section obviously, so we would bring the baby over to a warmer and get them warmed up and kind of stabilize him. He likely at this age would need a breathing tube at delivery. And sometimes if babies are breathing really well on his own and he's able to get 2 doses of steroids, I know we got the first one, which is good. But if he can get the 2 and at least wait 12 hours after that, he has the best chance of his lungs being a little bit more mature. Okay. So what we do is we put the breathing tube in at delivery most likely and give him some medicine for his lungs, because his lungs won't be producing this medicine surfactant for a couple days, and so usually we give some in the tube and that helps him breathe easier. Okay. Most likely would then also be admitted to the NICU with the tube in, and sometimes we'll take it out and just use some CPAP or like a little bit of pressure through his nose to help him breathe. Okay. We would, once he's stabilized, certainly Dad can come over, get some pictures, and then we bring him by so you could see him, but we try to make it really fast because it's important to get him back and get him warm really quickly. So we would at least bring him by so you could see what he looked like, okay? So then from day one, the lungs are one of the biggest challenges for babies this age. Once they're born, they just stop developing normally. So babies, even when they're born full term, their lungs aren't completely done developing. Basically, the lungs kind of look like a tree where you have your trunk and you have lots of branches and you have lots of leaves on the tree. A baby who is born at this age, it's kind of like a fall tree that doesn't have a lot of leaves left on it.
Yeah, it's a phenergon.
Oh, honey.
That's why I try. Let this fluid go faster and see if it will help.
Is it getting better?
Yeah, this will better.
Okay.
They will burn.
So a baby born at this age is kind of like a fall tree where they don't have very many leaves, and they need those leaves for the oxygen to get in and for the carbon dioxide to get out. And so once they're born, they just don't develop normally. The lungs kind of slow down. They form less of those leaves or those air sacs that we call alveoli, and they can get big and stretched out. And babies can sometimes need a breathing tube for a while, or even need oxygen long term or go home on oxygen. So that's one of the things that we're the most strict about, trying to wean them down off the ventilator and get them off the oxygen as soon as we can so that their lungs do better. Okay. But every baby's different. Some have the breathing tube for a couple days at 25 weeks, and some have it for weeks. So we just have to wait and see how he does. Okay.
Okay.
The next big thing is feeding. Are you planning to breastfeed?
Yeah.
Good. So we'd want you to pump as soon as he's born, as soon as you're able to. Pump every few hours and bring milk. He won't be able to work on a bottle until he's at least 32 weeks. Okay? And he has to be on lower support. Obviously, if you have a breathing tube at 32 weeks, we can't feed him from a bottle. But so at that age is when they're starting to learn how to suck and swallow and still breathe. So he'll have a tube in his nose or his mouth that we'll use to feed him until then. But your milk is definitely the best thing for him. It'll give him the most nutrition. It'll give him antibodies to help protect him because he's not going to have an immune system at this age. Okay. And then after we feed them really slowly because they're at risk of something that we call necrotizing enterocolitis. So it's basically infection in the belly. It's a long word. I will guarantee if he's born at 25 weeks that at some point his belly will get big, he'll be full of gas, and we'll be worried about that because that's something we take really seriously, and all of our babies get x-rays at some point for it. Because if he has an infection, you gotta stop feeding him and you have to treat it. So the feeds, we start really slowly. We just have like 1 to 2 milliliters, so a teeny tiny bit every 3 hours, starting after he's 24 hours old or so. So we wait a full day.
What's your name?
Sean.
And then we
S-E-A-N?
Yes,
just
ma'am.
feed that same amount for usually 5 days before we go up. So they just get a little bit, and that gives their stomach time to get used to the breast milk. Okay. So that's something we watch for. And next, certainly, any infection in a baby this size and this age, they can get really sick from, and it's certainly something that they can pass away from. So take it really seriously. Okay. The next big thing that we watch for is any kind of head bleeds. Babies born at this age, just like the rest of their body, their brain is not fully developed. So they have some tissue. The brain has like 2 sides, and it has little spaces in the middle called ventricles that we all have. Did you have a question for me? What'd you say?
You make you sleepy?
It can make you a little sleepy.
My eyes over here like, I'm like, what?
Well, and I know this is a lot of information, but I like to tell you everything now, and you're gonna forget a lot of it, and that's okay. Because if we're born early, we'll go over all this stuff lots of times, okay? But if you're falling asleep, it's okay. We'll just
I'm
keep
not-
talking. And
No, I'm not sleepy like I can keep my eyes open.
yeah. No, that medicine definitely can make you sleepy, especially in the IV.
Yes, I feel so much better. And I'm
That's
like,
good.
I know I hear her talk. I'm not sleeping with my eyes closed. So if I'm looking cross-eyed, that's why.
No worries. So just outside those spaces in the brain is the tissue that helps everything form normally. And when that tissue is still there up to 32 or 34 weeks, it can bleed. So babies at this age are very sensitive to getting bleeds. They can have bleeding into just the spaces, or sometimes they can have like a stroke. They can have bleeding in the brain tissue. So what we do for that is the first 5 days of life or more, where they're most at risk for that, we don't move them around a lot. They stay on their backs. We only touch them every 6 hours or so to try to not stimulate them too much, because if you kind of poke and prod them, it can make their blood pressure spike up and could cause bleeding. So at a week of life, we do the first ultrasound of the head to see if there's been any bleeding. And it's really the first 3 days that are the most critical there. They're most at risk for bleeding. And so what happens if they bleed is that they're at risk of having cerebral palsy. Have you heard of that?
No.
No.
No, ma'am.
Cerebral palsy, basically, the most classic thing you see is just kind of some weakness of the muscles or tightness of the muscles. So you may, some kids who are born really premature at this age, if they have a very severe bleed, they could even need some help from a wheelchair, or need help with feeding, need help with communicating. The more mild bleeds, sometimes they do nothing. Sometimes babies are healthy and have no problems, but they also could have, some tightness of their legs and need some physical therapy, maybe need braces, maybe need help walking, and could even have like a limp or abnormal walk for the rest of their lives. But at 25 weeks, you're in better shape than at 22 weeks or 23 weeks. And I think you're 25 and 4 today. Is that what they've told you? So you get to 26 weeks, your risk goes down even further. So every day we stay in, the chance of having kind of developmental issues in terms of learning troubles, problems in school, problems communicating, problems with your arms and legs, all of that gets better. Okay. So, that's something that we watch really closely. We get the ultrasound in a week. If that's normal, we check again at a month just to make sure everything still looks good. A lot of our babies at 25 weeks may have a little bleed. And if it's just, there's 4 different levels. And so if it's just a 1 or a 2, we're usually not too worried. Even babies born at 40 weeks, if we did an ultrasound of all your kids, they might have even had a tiny bleed and you just wouldn't know. Because it doesn't cause complications usually if it's really small. Okay? That's something that's a big deal that we watch for. Everything we do to babies when they're in the hospital, any medicines they get, if they're on the ventilator for a long time, all those things increase their chances of being a little bit delayed, not walking at the same time your other kids did, and all of those kinds of things. Okay? So, I know it's a lot, but the lungs, we talked about infections in the belly and the head. So one other thing that we always look for is their eyes, because oxygen is damaging to the eyes, but also when babies are born, their blood vessels in the back of their eyes are just not done growing yet. So our eye doctor checks all of our babies at around 4 weeks as their first check, and then they follow every week to 3 weeks to see if their blood vessels are normally developing. The eye doctor is great about explaining everything to the parents, so he would talk to you more about that. But if they were growing abnormally, it just puts them at risk for needing glasses. And sometimes they'll do a procedure to help the blood vessels to try to prevent needing glasses. The absolute worst case scenario would be having some level of blindness, but that's really rare. And so we try to prevent that by not giving them too much oxygen, having the eye doctors check them frequently, and then doing those procedures if they need it. Okay. One last thing is that he would definitely need blood at some point if he was born this early. His body's not going to make his own blood as fast. We take a lot of blood to make sure that he's healthy, and so we have to do blood transfusions every so often for babies born this early. They get a tiny bit of blood, oftentimes it's like a tablespoon, and it's screened in the lab to make sure that it's not going to interact, and usually the babies tolerate it really well. Okay. The other thing at delivery is that instead of a regular IV, we put IVs in the umbilical cord. Okay, so the umbilical cord has all these big blood vessels that have been feeding the baby from the placenta. And we use those because the lines can stay in longer, we can get better nutrition, and we can get labs there too, so we don't have to stick in this many times to get labs. Okay, and these are things that we would talk to you more about. We get consents and stuff for that, but that's what we would do right after birth. So after you get a chance to see him and take pictures, we bring him back to the NICU and we put those in, and then kind of get him closed up. He stays in the incubator until he's feeding well, so closer to 34, 35 weeks or after. And he initially will have lots of humidity in there to keep his skin moist, and so you'll see it'll be all cloudy in there and very warm. Okay? But in order for him to go home, he's got to be at least 35 weeks. He has to be at least 4 pounds. He's got to gain a lot of weight. And then he has to be taking all of his bottles and keeping his oxygen numbers good. Okay. The other thing babies do at this age is they forget to breathe a lot because their brain's not done developing, and so we give them caffeine to help with that, and that also can help prevent problems later on. So they get their little caffeine bolus once or twice a day, and that reminds them to breathe. And otherwise, we just watch the monitors. If the heart rate goes down, then we just kind of stimulate them, wake them up, and remind them to breathe. So that's the other thing they have to stop doing before they go home. Okay. Huh? It's a lot of stuff. It's a lot of stuff. But, and I don't expect you to remember any of it, but at least you've kind of heard these terms. And then once he came to us, we would just kind of keep talking to you at the bedside every day, updating you on what's going on. The ultrasound that we get at that first week mark, we would talk to you again about why we did that. So certainly any questions you have now or that you think of, if they seem like they're going to have to deliver the baby, you certainly can call and I can talk to you again. But we're just right now keeping our fingers crossed that he's going to stay in for a while longer.
Yes.
Okay?
Yes.
So every week is definitely huge in terms of all these things being less likely. But getting beyond 28 weeks is kind of a big milestone, because over 28 weeks there's kind of the lower, all these things are less likely. The bleeds are much less likely once we get beyond 28 weeks, the brain bleeds.
Okay.
Okay. Right. Do you guys have any questions?
No, ma'am.
Okay.
No,
I know there's a
ma'am.
lot of information, and again, we'll kind of go over everything again, but I think the big takeaway is that 25 weeks of survival is pretty good,
Mhm.
okay? It's just that we just have to do everything we can to make sure that he has the best quality of life when he survives and that he's not having a lot of challenges. So
Yes,
he would
ma'am.
have a lot of obstacles and he'd be with us for a while, but most of the time 25 weekers do well, okay?
Okay. Okay.
All right, well, you get some rest, and if you have more questions, let me know, okay?
Yes, ma'am.
I don't know what she did.
But she
Thank
gave you
you.
Phenergan. It's a nausea medicine, and it makes you feel better, but it definitely makes you nap.
Oh, she gave me some pain medicine.
Oh, did she do that too? I think she said she gave you Phenergan though, and that's the nausea one, and that one makes you sleepy too.
She had mixed it up.
So are you having some contractions too?
Yes,
Yeah.
yes, that's what it is. Every time, it starts in the muscle, but it all hurt at the
Yeah.
bottom and then go away.
Okay.
Yes,
But they said you weren't dilated, right? They didn't tell me that you were
They
dilated.
didn't check it. They probably didn't check because of the placenta.
Yeah, because you're bleeding. Okay.
Mhm.
All right. Well, hopefully the contractions will stop and he'll stay in there. Okay.
Yes, ma'am.
Thank you.
No problem.
Thank
Nice
you.
to meet you guys.
Nice to meet you.
Mhm.
So they were trying to stop me from having the baby, which they did. They stopped the contractions. They stopped me from bleeding. They was giving me fluid. They were giving me the magnesium. That was going to help, with everything. Then they gave me another fluid.
Steroid.
Yeah, 2 steroid shots.
Mhm.
Then they gave me the fluid to help with, if I do have the baby early, the brain wouldn't bleed. So they gave me medication for that also.
Yeah, they were giving her a lot.
And my doctor didn't want to release me, so she
Yeah.
kept me. She
Yeah.
would make sure everything good. And on top of that, my diabetes, it looked like it wasn't getting under control in the hospital, so they actually gave me instant shots.
Yeah.
So
Like instant shots after every meal.
they would
Then they
get
would
before.
double it.
So
Yeah,
they-
before and after.
Yeah, so they were giving to me before meals. They would give me a shot before meal. Then they was come back 2 hours after I eat and check my sugar. So if it was high, I get another shot
Yeah.
to get it down.
Yeah.
And
And then they were getting so many that it got too long.
yeah, I almost croaked.
See, I want you to see.
I almost croaked. It went down.
The nurse came up and there, is you feeling well? I was like, oh man,
They was-
really?
Yeah, they was starving me. They was feeding me in the
Oh,
morning,
man.
lunch, and dinner was at 5 o'clock. So, and then on top of that,
after dinner, she ain't had nothing else
and
that
then they would
night.
give me a big dose of insulin like at 10 o'clock at night
Yeah,
with no snack or no nap. So my sugar dropped to like 43.
yeah.
They were like, you okay? And they were trying to hurry up and give me something to bring it back up.
Yeah.
I'm like, I'm fine.
They were like, this don't near supposed to be that low.
Yes, it was too low.
Oh man. Oh man.
So everything else went by fine.
And then
The
came
nurse,
up to the time that it was time to you to leave at
the sixth day.
the 6th day. Yeah. And after this, and when it was time for her to leave, I'm talking about she happy. I'm talking about
But before then, I was supposed to have left Thursday or that Friday. Then my doctor kept
Yeah.
pushing me.
So there.
I was crying. I cried because I was like, I'm ready to go. I'm ready to be in my own bed. I want to be comfortable. That labor and delivery bed was so hard. It uncomfortable.
Yeah.
I just couldn't do it.
Yeah.
Then having that band around you, monitoring the baby 24/7. It was just more stress and depression and
The nurse that we had, she's nice. I promise you, she's nice as hell.
yeah.
Nice. But she didn't want her to go home at all. Like, she didn't want her to go home at all. At all. Like,
They came to that day, that Saturday.
at all.
I ain't ate lunch. She told me you gotta eat before you go. I ate. I ain't want the lunch, so she went and got me a tuna sandwich from the cafeteria.
Yeah.
I ate it. I was like, okay, that good enough.
Yeah.
And she's like, okay, the baby ain't acting like he was. Oh my God, she's trying to keep me. She trying to keep me. So I'm like, the baby ain't acting cause the baby tired. And then she gave me a diet drink, a diet
Yeah.
coke.
Yeah, try to get the baby back to moving.
Yeah, cause I ain't ate lunch. And that baby be home. Y'all be starving me. That baby home. That baby want to come home and eat. That's what he want to do.
Then, time for to get out of there. Couple of hours, time for to get out of there. She called me, babe, I'm ready to come home. They releasing me. Where you at? I was like, I am on the way. I'm coming. Because I was at home with the kids, making sure they do what they have to do. So, got there. It's raining. You know, got in the car. No, I left the kids at the house.
No, yeah, you left them.
Yeah,
that
I let
time.
them at the house. Cause
It
I left them
wasn't
at
raining,
the house.
did it?
No, it wasn't raining that day.
No,
It wasn't raining that day.
no.
I left them at the house. I called her mama and told her mama to come over here. That was your mama?
Yeah, my mom was. Yeah, my mom came back over here.
Yes,
So you gave her a
yeah.
break. She came back.
Yeah. And then I went and got her. Then as soon I got her, we coming home. Remind you, we don't stay that far. Like, we don't stay like a huge distance.
Probably 12 minutes from the hospital.
Yeah. So, coming back home. She happy to be out. I'm happy she out, you know, just for to lay in the bed, go to sleep. I was tired of sleeping on that sofa. I'm tired of that sofa. You know, I'm tired of it. So, we coming home. We made it to the light in front of our house. Well, in front of our little driveway for to go in our house.
Yeah.
Made it to the light.
I'm like,
She
oh.
looked at me. Oh, babe, I'm bleeding. It feel like I'm bleeding.
And it feel like it's a lot. It was so much.
I was
And it
like,
felt like a big old cloud.
I told her,
Oh my
I said,
God.
you sure? You know you supposed to. I ain't want to go back up there. You know, I'm sorry, but I didn't want to go back up there. So she told me that, you know, she bleeding and stuff. So I'm like,
I said, feel like it.
she like, I'm bleeding or I'm peeing on myself.
No, I said my water broke.
Yeah, no, you said you peeing on yourself.
I said water broke.
You said that too. You said both.
Oh, okay.
And then I was like, maybe, I don't know. Well, we'll just see when we get home because we right here by the house.
You said that. I said maybe my water just full. Maybe I'm peeing on myself. Yeah.
So I was like, okay, we'll figure that out when we get to the house because we right here. You know what I'm saying? Because, you know, there's nowhere for we to stop and actually look because we in traffic. So, you know, soon we get to the house. Pull up. I ain't even shut the car. Soon she got up, never blood just started pouring out. I'm like, bro. So I'm panicking. I ain't trying to show up that I'm panicking, but I'm panicking, you know. And then when
he showed me. He scared me.
not really, not really. You know, I was panicking, but but anyway. So when I was over there, so
He unlocked it.
I got her out and stuff, and so she got out, and blood just leaking everywhere. I'm like, oh man. So next thing you know, she had a big blood clot coming out. And remind you, she had on the dress, panties, a pad. She had on all that. And there's a big blood clot coming out like a liver. So I'm like, that don't look right. That really don't look right.
So he went and tried to open the door. He unlocked the door because my mother was in here with the kids. So he unlocked the door. He was like, Jesse.
Yeah, I ain't even wanting to say it loud. I knew.
Jesse, can you come in? Can you come in? So I was looking at her, oh, no, you did that.
so her mama came out there. She like, oh my God, baby, sit down. Go get a chair. I was like,
call the ambulance.
Yeah, call the ambulance.
And no need to try to rush her back. Call somebody.
And she stand over there. Let me see. I'm like, no, I'm not finna let you see that. You know what I'm saying? Because I know for a fact if I would have showed her that, she would have panicked even more. You know, because
I was panicked. Like, I want to know where it was.
Yeah, but she would have panicked even more because that right there, it's like something was wrong with the baby and stuff like that. So that right there scared me. So, but that's not even the bad part. The bad part is when the ambulance got here.
First, the fire rescue came.
Yeah.
They came and, of course, they asked questions. And they were trying to start an IV on me before the ambulance come. He looked at my arm. He was scared because he seen all the bruises. He seen all the bruises in the hospital did. He was scared. So he was trying to start an IV. I forgot where you stuck me at. Right here. That spot. Look at that.
That spot still.
It's still. I got a black spot right there on my hand. But anyway, he tried to put the IV right there in my hand, and he hit the vein. It started bleeding. So he took it out. He was like, it's like. So he covered that up fast.
So after all that, like, they dealing with that situation. Her and her mama, you know, and the ambulance folk, they dealing with her. You know, I got my daughter. I got Peyton with me, and she's 2 years old. I got her with me, so I'm walking and talking on the phone to my mama, and my mama, she panicking. You know, when I told her the situation that's going on, she panicking. She started crying. And she got off work, you know, and I'm like, oh man. But then when I was going back up there with her and her mama and them, her mama looked at me and said, hey, they just said that the baby ain't moving.
Yeah, I didn't fuck the baby.
I was like, oh man.
Oh, she told you?
Yeah, she told me that.
Yeah, I ain't fuck the baby moving at all. So my mama asked me that I felt the baby move with a man. Something I don't remember. But one of them asked me that I felt the baby move. I'm like, no, I haven't felt the baby move a little bit. No. So, the ambulance got here. It didn't take long for the ambulance to get here. But the ambulance did get here. They rushed up here. They immediately, they got the information where they needed. They put me on the stretcher, and oh my God, it was so rough. We got to heal, and then remember my stomach already hurt, so they hit that little.
That's all that hurt. Oh man, they killed her.
Hey, damn, y'all need to be a little gentle. Oh. But anyway, they got me on there before we pull off. And the female that was on the ambulance, she was excellent. She did the IV. I forget what she put it.
She put it right over here.
It was like
I don't
right
know what
here.
she put it at, but she put it perfect though.
Yeah, it was perfect that I ain't had to get me in no more.
And then she wasn't hurt.
Yeah.
IV too, so.
And she did it quick. I didn't even felt it. So basically they checked me. They made sure that it wasn't the baby that they seen that was a big liver, as he say. But they made sure that it wasn't the baby. So of course they called the hospital and they warned the hospital that I just left the hospital They said it's 29-year-old female. She just left the hospital, and they told, you know, the reason she had a previous placenta. She is pregnant. See, they asked me. they said I was pregnant with twins. So
What?
they was. No, you remember they said it out there too. Like, no, I'm not pregnant with twins. They did. She was like, why they told me that? Cause the virus. I guess we said that I had twins.
Yeah.
I had twins, but they reached out to the hospital. So of course the hospital was. They contacted my doctor, and the doctor assisted her. So when we got there, everybody was rushing. Everybody was on point. They were ready for me. I can't tell you that they was ready.
When I got up there,
It was hard for him to get back on the
I
floor
know.
because they just discharged me. So
yeah, they was.
I'm nervous because I'm like, where he at? Where he at?
They,
So
they told me, hey,
he couldn't go out there because I was
we don't
in.
know where she at, so it's just sit right here until we found.
So I'm talking to the nurse. I'm like, the phone in the room they had me because they were prepping me. They was prepping me. They were hurrying me up. They were like, okay, the IV good. They dressed me. They took all my clothes out. They put me in the other bed. They were prepping me. They was getting the anesthesia ready for the, you know, because I had to have a C-section. They was like, this emergency, we're going to take it. Take the baby. I'm like, where he at? I can't go in there by myself. I'm getting nervous. I'm like, where he at? So like, can you call my fiance? Like, he had my phone, so they called his phone. His phone was dead. It was like,
lucky. Some told me
to get my phone.
Some told me to get out that game because I was in the lobby. I played my game until I ran my phone dead.
Oh, so you ran your phone. That phone was already dead.
So I put mine in my pocket. I had hers. Well, might as well play the game until they called. But some told me, hey, get off that phone because it was on 5%. I was like, oh man. Someone like, get off that phone, get off the phone. So I just got off it. I was like, I'm saying this battery, you know. So I put it in my pocket, and then soon that happened,
They
a few
called.
minutes later, they called and said, you know, we need you up here at the delivery room. You know, you already know where to come. I was like, yes. So they were like, okay. So I immediately went up there. It was me and her mom. So I went in. Her mama stayed in the waiting room. And when we got in there, they were doing their surgery pause and all that.
And they were finna prep me. They had already.
Yeah.
What was it called in back? I forget.
What? I don't know that shot.
I forget.
Yeah, I don't know the shot. But
No, what had it? But the anesthesia, you know, they numb you. So of course they numb you from all this, from your stomach all the way down. So I didn't feel anything. But he came in there.
no. When I came in there, you know, with a C-section, all C-section, that's every C-section that I went in there with her with, and they always tell you don't look past the curtains. So
Little sheets they have.
So me, I'm already weak stomach. I'm not finna look no way, cause if I look, I know I'm not looking. So I'm over there, you know, paying attention to her, talking to her, making sure she's straight. Then next thing you know, she looking like she's on and out. I'm like, hey, you alright? She said, yeah, I'm alright. I'm like, alright. So I'm just talking to her. So I'm just talking to her. So I'm like, alright, you straight, right? She was like, yeah. So next thing you know, all I hear is the baby came out crying. It's like, oh yeah, baby out, that's a good sign, you crying already, you know, cause she doing the early labor, so the lungs ain't developed all the way, but
At least I had that steroid shot.
we got his lung developing a little bit enough for he can cry. So I'm looking like, yes, that's a good sign. It's a good sign. Oh yeah. So she telling me, oh, you gonna go take pictures? Remind you that they said we couldn't you know, we can take pictures, but it was gonna be quick because they gotta get the baby out. They don't even wash the baby up. They just clean them off as best as they can and take them back there and put them out in the light because they need UV light because the body heat and all that. They was telling us all this before we even, you know, go in there. So I'm already knowing what's going on. So I'm like, nah, I'm gonna wait till they get through and then I'm just gonna go over there, snap, we done, and they can go ahead and take the baby. So she was like, okay. So then next thing you know, they get through. She over there still laying down. So she was like, go ahead and take the baby. She wasn't gonna stop it until I get that baby picture. So I went over there, took the baby, a little few pictures, boom, boom, boom. Went back over there to her and stuff because they had to take the baby. Next thing you know, I showed her the baby. She was like, oh, that's pretty. And then next thing you know, she was holding my hand. Then she started letting go. I'm like, hey, wake up. Hey, you alright? You alright?
And the only way he was paranoid because my previous pregnancy they almost killed me.
Yeah, that's why I was so paranoid because pre-pregnancy, you know, with Peyton, they almost killed her for real because
I had no option.
Yeah, we was sitting there and then they was like, you know,
the anesthesia.
Squeeze. If she squeezed down, she's good. She don't need no oxygen. And so every time I was asking her if she good and she was squeezing down, then I asked her if she was good. She squeezed down a little bit, and it's like she was going out. Like she literally like she was going out.
I was going out while pregnant Peyton.
Until I told them folk, you know, and they were like, "Oh no, just give her some oxygen." They legitimate had
the anesthesia said, "Didn't I told you this feel like this?
Yeah.
You're kidding me." The doctor like, "Oh, give her the oxygen."
Yeah, like they was legitimate. She about to go out of here. I'm like, yo. So that's why I'm so paranoid now because I'm like, oh man, you know, you know what I'm saying. I'm trying to make sure she's straight. So then they had to do all the rest of their stuff, you know, attach her up and all that. So they told me to leave out the room before they can do that. So I left out. You know, they get her ready, doing everything they have to do to her. And once they doing everything they have to do to her, they got done and her doctor came out, said everything was a success. She doing good. The baby, she was like, the baby doing good. And then she took me to the room and stuff like that. I talked to her mama and told her mama that the baby doing good. She saw the baby when the baby was going to the room, you know, and she took a couple pictures and stuff like that. And then we went to, then they brought her out, put her in the room, and after they put her in the room, what happened?
So basically when they put me in the room, of course, you know, I was zoning out and stuff, but they put me in the postpartum, what is it? They put me in my room that I was going to be in. So basically when I got in that room, of course, I was out, I was still numb from everything. So that day they just come in there and they was making sure that my sugar was low. They didn't feed me anything, of course. Making sure my sugar stayed under control. They made sure they pressed down on my stomach because after I had the surgery, so they had to remove the previous placenta before they got the baby out. They had to do that also. So, of course, they was making sure that, so the next day, that's when they made sure that I wasn't bleeding heavy. They were making sure that, that's when they took they was making sure that I didn't bleed heavy. And they took, you know, made sure I started using the restroom on my own. It was hard. It was hard to just even urinate. It was hard. It felt like I had to, but I couldn't. So, but when I used it for like the first 3 times after that, it wasn't hard. It was normal. I had to keep my bladder empty. Of course, they checked my sugar regular. They checked my blood regular. The baby, you know, of course, he was still doing good. They had him on the ventilator. They had him, you know, and you went to visit him the first time.
I went to visit him the first time.
The first day.
And, you know, they had him under the UV light. Had him on a breathing machine. You know, everything attached to him and all that. And me, I'm looking like, yo, you know, some like you don't like when you see that and you see your child like that, you like, yo, like I can't do nothing to help. You know, I
Yeah.
can't do nothing to help. You know, the only thing I can do is just pray that he do good and he get well. That's all I can do. I can't do nothing. And me feeling like that, I'm like, bro, it's not a good feeling. Like, that's really not a good feeling. But in my head, I'm trying to put in my head, okay, you know, he's here. He here, you know, they got some good doctors that gonna do what they gotta do for to take care of him, for to make sure he's straight, for to make sure he get good enough to come home and stuff like that. So that's the only thing I'm putting in my head, you know. And then I'm over there like, okay. So I'm down there, I'm taking pictures. Went back to the room, was showing her if she wanna get up and walk and go see him.
Which is, you're not supposed
How?
to walk.
How?
Not supposed to walk.
How?
I went the next day.
Exactly.
I went the next
She
day.
wanted to go down there then.
Yeah.
How? How?
So-
I told her how.
But okay, so when I went the next day, I walked around the, you know, the little thing for about 2 or 3 times.
Yep.
No. About 3. Yeah, about 3 times.
About 3 times.
Yeah, I walked around there 3
Yeah.
times. Now let me go see the baby. So I went to see the baby, sat by the baby. You know, I'm happy because I'm actually there with him. I'm actually seeing him for the first time. With, you know, the first time was the picture, so I'm actually seeing him for the first time. Then I'm getting lightheaded.
Yeah.
I'm getting lightheaded, and I'm like,
Getting hot.
yes,
She's
I'm sweating. I'm
Ugh.
like,
I'm like,
I got to go because it feel like I'm finna faint. I got to go. And it wasn't because of the baby. It was, I wasn't healed and well all the way. And I'm telling them that I had told them before earlier that day that I was woozy.
yeah, you did.
I was woozy.
You did.
And I was like, I'm telling them like my blood or something probably low because I'm sweating. Now. You know?
They said the COVID-19.
Yeah, they was like,
They
your
thought it was
temperature.
COVID.
Yeah. They,
I'm like, COVID?
I'm like, if
How
I-
she get the COVID? If she
And
get the COVID, she get the COVID for him.
And that's what I said. I was like, they gave me a COVID test. A COVID test. I'm like, okay, but all because I got just a fever.
Exactly. I was like, y'all gonna have to tell me something because you get cold from him. We
Yeah.
don't even go nowhere. We stay in the house.
Yeah.
So she get
And
the
I've
cold
been
from
here
him.
for almost a week, so
You get the cold from him now.
I
Stop
was
playing
there for
now.
a week then.
Yeah. you
I was
was
there
for
for,
a
I was
week.
like, oh, what? I
You
was like,
there for a week.
she making me nervous. Like, what? Okay, so they're like, okay, we have the results within an hour. So came back, oh, great news. COVID negative. I told you. Okay, I told you when that. So later on, it was like your white blood cells are low, or they said red blood cells. One of
I
them.
don't know. You know, I wasn't there.
It was one of them.
Out here then.
Yeah, it was one of them. That was, I think they said red blood cells were low. It was one of them, red blood cells. And it was like, they had to give me a blood transfer. You was asleep.
I thought I was gone.
No, you was over there asleep. And I would wake you up and I tell you, they finna give me a blood transfusion. I'm like, I don't
I'm
want to go.
down there. Yo, I was sleeping.
Let me tell you what I said. Let me get fit. I'm like, I'm nervous now. Because I'm like, oh my God. Okay, I got to get a blood transfusion. Okay. Nooba, wake up. Because I'm out of it. They gave me pain pills. And I do not want to go to sleep while they give me blood. I'm nervous that something happened to me. You in here. And you'll know. So, and then on top of that, the complication I had after that, so they had to give me a blood transfusion and my heart rate kept dropping. Mm-hmm. And I had a temperature. They didn't know why I had a temperature. They didn't, my heart rate was dropping. It was like, and then I had to get a blood transfusion.
Mm-hmm.
So they gave me a blood transfusion. It was like how the next day out, they gave me two.
Yeah, they tell you
Two
two
pints.
pints.
Yeah, 2 pints.
2 pints.
So they came, and of course they pulled more blood, checked the blood cells again. This time, they were too much blood they gave me.
I was like, oh Jesus.
I'm like, oh, y'all the one gave me all that blood. Then it was like, we're gonna pull some more blood in the morning and just make sure, you know, everything good, cause your blood cell count is too high. I'm like, y'all the one gave me them 2 pints of blood. but the next day, of course, they check everything. Everything was normal. I'm like, yay. So they gave me the transfusion. I did start feeling better. My heart rate and, you know, my temperature and everything got back normal. My sugar was normal. I didn't have to have any more insulin. Yay! After I had the baby. So my sugar still continues to be good since I've been home. So everything has been great since I've been home.
Only thing now, she's getting postponed depression.
Anxiety.
Yeah, like it's not as much, but it's often. So she got some pills for that. You know, we try not to use them if possible. And she just got them 3 days ago.
Yeah, a couple days ago. Take one a day.
Yeah,
It just helped with the anxiety because I couldn't breathe. I used to wake up out of my sleep when I first got home. I was like, I can't breathe. I was having an anxiety attack.
I was like, I'm like, yo, you can't breathe.
You
Oh,
breathing?
man,
He's
next thing you know, I was asleep. Like no,
I was
she was asleep. I was playing on my phone, playing my game on my phone. Next thing you know, she get up. I can't breathe. I'm like, you breathing? Like, what you talking about?
You just
like you breathing hard. You breathing hard. Like, what is you talking about? No, I can't breathe. I can't breathe.
It felt like I
What?
couldn't breathe.
I'm like, oh my
It
god.
was hard for me to breathe. I don't care what nobody said. It was hard for me to breathe. But to come to find out I was having anxiety attack.
I told you, I was like, you must be having
I was
panic
depressed.
attack. You know, I was like, you must be panicking or something like that. Like, you must be depressed or something.
I was worried.
She was like, no, I'm not depressed and that like that. Which, and I know, you know, from the previous pregnancy that she had, that's what she did. So I'm like,
I ain't never had no anxiety
yes, she
attack.
did.
I went like that. Did worse. I don't know.
Don't story like she had it.
No, with Peggy, you told
Yeah,
me
she-
twin.
Yeah,
With the twin?
yeah.
Them twin.
Yeah.
What you expect?
She had it, so I was already expecting it. So, but right now, everything going good. You know, everything going well.
The baby, he's doing great.
Yeah, it's gonna be we're gonna do another video about everything about the baby.
Yes.
You know, everything about the baby, every detail that you know he been going through since he been in there. The details that everything that we've been going through, why he been in there, as far as going to see him and stuff like that.
Yes.
So we gonna talk about all that on another video. You know, this video right here is just updating y'all on
My pregnancy and everything we've been going through.
But if y'all made it this far in the video, don't forget to like, subscribe, and turn on that notification bell, man, because the TDF fam, we gonna get stronger every day by the minute.
And for everyone that have showed us love, have sent comments, who have subscribed, we have reached 1,000 subscribers. We really appreciate you guys' support, your love, your motivations.
Say hey, you guys.
Hi
So welcome back
guys.
to our channel, the Dudley family.
Yay!
Say, how y'all doing?
Hi,
Y'all doing fine?
I'm fine.
You doing what?
Bye bye.
Bye.